Hi everyone, we're Team C3, and our project is titled A Three-Pronged Approach to Safe Nursing Home Transportation. Our prompt was to figure out a way to safely transport nursing home residents in and out of the facilities without increasing the risk of COVID transmission. So for a little bit of background, nursing home residents are more susceptible to COVID morbidity, mortality due to living in close quarters, their older age, and overall poor health. And when they and the staff move in and out of healthcare facilities, that increases the risk of transmission. The WHO has recommended restricting transportation to only those who require essential care. However, urgent care will always come up at some point. So patients, residents, staff at the giving and receiving facility, and transport workers and EMS staff are at risk by moving patients, especially with ineffective communication between the parties. So we are presenting our three-pronged approach to mitigate some of that risk.
So the first of our three-pronged approach is trying to prevent transports that are unnecessary. We're first going to do this by enhancing our telemedicine visits by using mobile hotspots, computers with adequate speakers and cameras so that our residents and providers can communicate with each other. We're going to have designated visit areas within the nursing home so that providers who have tested negative with COVID can come in and provide services such as dental care to our residents. We're also going to increase communication with our residents to help avoid unnecessary visits by making sure they have their hearing aids and they don't require unnecessary transports. And the last thing is expanding our pharmacy storage capacity to avoid missing medications that might lead to transportations and to reduce the number of visits and of medications into our facility. The idea of this is to prevent the number of transports, which would be demonstrated by increased number of telemedicine and in-house visits.
The second tier of our approach is emergency transport. Residents will have pre-transfer preparation and stabilization by trained staff. There will be designated exits from the nursing home. Emergency kits will be equipped with super ears, PPE, and a tablet with the transcribing app to accompany the resident. The emergency department will be contacted immediately after EMS to notify of resident arrival and arrange for rapid COVID testing. Nursing home triage prior to hospital arrival will be done so that the patient can be directly taken to the ICU, OR, imaging, or dialysis suites. Brief resident medical charts will also be available for adequate handoff between nursing home staff and medical facilities. The nursing home will be notified of any COVID exposures.
The third tier of our approach is non-emergency transport. We're going to have a designated nursing home shuttle, and we'll coordinate outpatient appointments for nursing home residents with their recent COVID tests to ensure they're negative. We'll also have adequate screening for residents and staff and require masks during transport, as well as limiting contact with the drivers by having a barrier between the front of vehicles and the back of vehicles, and include one patient per vehicle at a time, as well as disinfecting following each transport and ensuring a period of isolation after transport to an appointment for each resident. The measures of success for both emergency and non-emergency transport are below. The number of COVID cases, resident outcomes, duration of transport, and compliance with PPP are all measures of success.
Our expectations for this project are decreased number of COVID cases, increased staff and resident satisfaction, and fewer non-essential visits. We believe our project has strengths that it's multifaceted and multidisciplinary, is evidence-based, minimizes resident contact, provides alternatives to hospital transport, repurposes unused nursing home space, alleviates communication barriers, and provides high-quality, effective, and efficient transitions of care. Some challenges and barriers include COVID screening. We'd require regular testing, temperature checks, and would need to work with local EDs to acquire rapid tests. COVID exposure at non-nursing home sites would be addressed with isolation precautions and a requirement of 2 negative tests prior to isolation removal and adequate PPE for all contacts. Inadequate funding is another challenge and could be addressed with increased government reimbursement and application for grants. Our next steps are to track cases, continue cost assessment, and continue to solicit feedback from residents, nursing home and outside medical and facility staff.